It's hard enough just to get a diagnosis of psoriatic arthritis, but figuring out what to do about it and specifically which specialist you should listen to is a whole other can of worms. Having psoriatic arthritis can demand you have both a rheumatologist and a dermatologist, which doubles the appointments, the testing, and the opinions. We all know you should be the one making your own health decisions, but how do you do that when you have to manage two specialists and they're sometimes quite different opinions? There absolutely is a way, and I'm going to share with you everything you need to know to successfully navigate psoriatic arthritis treatment so your specialists are all on the same page and you feel your best. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Before we can decide who to tell what in order to get us on the right track, we need to understand all the players and their roles. In a perfect world, you could go to a dedicated psoriatic arthritis clinic, and they do exist, by the way, where you would see a dermatologist alongside a rheumatologist, and together y'all can come up with a plan forward that everyone agrees on. These psoriatic arthritis clinics are usually in academic medical centers and can be hard to get into, so suffice to say, very few of us live in that world. What most of us have to deal with is having a dermatologist in one part of town and a rheumatologist in another, and the two rarely speak if they even know each other at all. It may seem obvious, but the dermatologist's role is going to be to look after your skin. They are psoriasis experts and can judge what type of psoriasis you have, because yes, there are different types, and assess the severity of your skin inflammation. They do this by evaluating the extent of skin disease, which they measure by body surface area. They take a rough estimate of the amount of skin that has psoriasis and can use that as a measure to see if it's getting better or worse. And just for perspective, less than 3% body surface area is considered mild, while more than 10% is considered severe. Rheumatologists are more in tune with your joint disease. Rheumatologists also tend to think a little more holistically than dermatologists, just due to the nature of our specialty and the fact that we are internists by training, whereas dermatologists aren't. Rheumatologists tend to think about long-term health of the joints with a focus on not only controlling inflammation today, but preventing damage and disability to the joints in the future. Dermatologists certainly want to control your skin inflammation as well, but the focus tends to be more on today than the future. Each role is important and can bring a different expertise to your care, but their approach tends to be only focused on the area of their specialty, which requires you to be the one always with the bigger picture in mind. How to do that and which questions to ask which doctor is what I'm going to get into in a bit, but first, let's talk about the actual treatment choices. The treatment options for psoriatic arthritis have exploded in the last 25 years. Similar to rheumatoid arthritis, we are firmly in the age of biologics and have therapies that can essentially halt all inflammation and joint destruction. Choosing which is going to be right for you, however, is still more of an art than a science, so understanding your flavor of psoriatic arthritis and what your personal priorities are will be key in creating a plan that's right for you. Usually, the first options your doctor may talk with you about are going to be the older medications. These are medications like methotrexate or even hydroxychloroquine. These are older, well-established medicines that we use in many different autoimmune conditions, especially in those where arthritis is a predominant feature. Each medicine has their pros and cons, which you can talk about with your prescribing doctor. If those medicines aren't a good fit for you, or they aren't doing what you need them to do, we will then look at the biologics. Biologics is a general term we use to describe a group of medications that are developed from organic material and target certain proteins in our bodies. When we use them in autoimmune disease, they target inflammatory proteins that are elevated when we have conditions like psoriatic arthritis. TNF-alpha inhibitors were the first class of biologics to come out in the 1990s, first for rheumatoid and then for psoriatic arthritis. We found that although many with psoriatic arthritis do well with these medications, there was a large number of people who didn't. This then ushered in much needed research into psoriatic arthritis to better understand what's going on a cellular level. And lo and behold, psoriatic arthritis is different than RA, which makes sense as those of us that have taken care of psoriatic arthritis have known for decades that it's not just RA with a rash, but an entirely different entity. So it makes sense the biology would be different and it would need different treatments. And different treatments certainly have come. Treatments focused on different cytokines, which is just another type of inflammatory protein, showed to be effective for the joint and skin diseases of psoriatic arthritis, all to varying degrees. Now, I am not going to go through each treatment one by one and discuss their pros and cons, because that would be super boring and likely put me to sleep. But I have created a table that I will put up and you can screenshot and look more closely into later. You'll see that not every biologic is equally as effective for the joints as they are in the skin and vice versa. Now, this is just in general, and there is, of course, person-to-person variability, but these generalizations come into play when you think about your own situation and how to find the right plan for you. And one last point, psoriatic arthritis treatment strategy follows a similar treat-to-target strategy as rheumatoid arthritis. This simply means that you and your doctor agree on a target, and usually it's remission, and that at every visit, y'all will assess, do you still have inflammation? And if so, how much? And if it's determined that you do, together you'll make some sort of change to your plan to get you closer to your target, which is remission. Okay, so now let's put this all together. How do you handle these two specialists, all these treatment options, and your condition? We are always looking for that one stone that will get rid of all the birds, right? So naturally, both your specialists, the derm and the rheum, are going to want treatments that will hopefully silence the inflammation in your joints and your skin. But sometimes which treatment is best to do that can be a question. So I recommend taking some time to consider for yourself, what is your predominant problem? In many cases, joint inflammation gets more in the way with our quality of life than our skin disease does, but this isn't always the case. I've certainly had patients who are actors or models where skin inflammation is certainly a major concern, and they've told me they would rather deal with some joint stiffness than have bad psoriasis. This is also going to be dependent on your flavor of psoriatic arthritis. How severe is your skin disease? Where on your body is it? How severe is your joint disease? And is it just one or two joints, or is it multiple? And how debilitating is it? Are you needing daily NSAIDs to control it? Now, put all these answers into the context of your life. Think about your responsibilities at home and at work, and it should start to become clear what your priority is. Again, there is no right or wrong answer here, and I've had as many people tell me they can deal with a little stiffness as I've had tell me they don't care about their skin. Now that you know what your priorities are, you can go to your doctor's office and get their input. You are the expert in your own life and know what's important to you better than they do. But they may have some insight based on your general health, your lab results, or your imaging that may need to be taken into consideration when you're developing a plan. So a common example of this is your skin may be your priority, but you come to me and I'm worried about your joints because we already see joint damage on x-rays. This doesn't mean you have to do what I say. You don't have to do anything, but it means that we need to have the conversation. Once a priority has been agreed upon, we don't want to forget about the secondary symptom. Just because we're agreeing that your joints, for example, are our focus, doesn't mean we forget about your skin. So the next set of questions you want to ask yourself and your doctors are about what strategies are there to address our skin or joint pain should our primary treatment not fully address it. So if your primary treatment is focused on the joints, but your skin is still inflamed, how can you tweak your topical treatments to better control your skin? Would you benefit from light therapy? If it's your skin you're focused on, what options do you have for joint pain? Does a joint injection make sense? Remember, bringing these questions up does not guarantee you that your doctor is going to agree. These are conversation starters, but they will get you and your docs on the same page and working towards the same target. And then we have the very real problem of managing two different doctors and two different clinics. Doctors tend to talk to each other through the ancient technology of fax machines via medical notes that have many, many words, but say very little. As I was thinking through this problem for the video, I came up with a psoriatic arthritis appointment tracker template. It's so much easier for me to just give you a template to use to organize your thoughts and your doctor's plans than to try to explain what you can do. You don't need to provide each doctor with a play-by-play of how the appointments are going. Really, what you need to communicate is how did the other doctor think you were doing? And did they have a new recommendation? Sprinkle that in with how you're feeling, and your doctor will know what they need to know. Follow the link in the description to get your psoriatic arthritis appointment tracker. And also, I don't want to forget to mention that even though I've spent the majority of this video focused on prescription medication as a treatment strategy, lifestyle choices like an anti-inflammatory diet, getting enough sleep, moving your body, and being surrounded by a strong community absolutely makes a difference and may in fact be the one stone for the two birds that you're looking for. We are light years ahead in our approach to psoriatic arthritis than we were even at the start of my career. But we don't want the clunkiness of our healthcare system to get in the way of accessing all that progress. I hope you found this helpful. Remember, it helps us play nice with the algorithm if you can like and subscribe. If you want to learn more about psoriatic arthritis or starting biologics, I'll put links in the description box for those videos. I do recommend starting this one next though. Thanks for watching, and I'll see you next time.